Neutrophils and lymphocytes are two types of white blood cells, and they show up on a CBC with differential. The way we used to manually count out differentials and the way CBC automators currently report out the differential is as percentages. So we count 100 nucleated cells, 100 white blood cells generally, and then identify how many of those are neutrophils, how many of those are lymphocytes, etc. So if we use the analogy that your white blood cells, which are an important part of your immune system, are like your military, think of the neutrophils like the Marines. They are the first ones to the fight. They're ready to go. They're going to be first on the scene at the site of infection and inflammation. So it's common when we see patients with acute inflammatory process going on, especially acute infection, to see their white count go up. And when we look at the differential, the percentage of neutrophils has gone up. Lymphocytes are a little bit more specialized. And interestingly, in some types of inflammation and infection, including autoimmune disease, the lymphocyte count will actually be suppressed. Interest in the neutrophil to lymphocyte ratio stemmed back to 1950s, 1960s, when we were using the CBC with differential very commonly, and there was a big interest in what could be the clinical significance of changes in these ratios. So if your NLR is increasing, could that be prognostic? So how somebody with a particular infection or cancer is going to how their disease might progress. Could it even contribute to diagnostic criteria? And not surprisingly, a lot of this interest in CBC parameter changes with relationship to infection came in the tuberculosis literature. So in patients where their NLR, their neutrophil to lymphocyte ratio, is going up, that suggests that there is a predominance of neutrophils or neutrophilia, and that generally is a marker of acute and sometimes also chronic inflammation. Hope that helps. Follow for more information about blood.